Sermorelin versus Ipamorelin. Make an informed decision. While ipamorelin acetate and sermorelin work similarly, there are some distinct differences which set them apart. While both boost HGH secretion via anterior pituitary activation, ipamorelin does not signal quite as strong as its counterpart. This makes it the better choice for patients with mild to moderate HGH deficiency because it can get growth hormone levels back into the normal range with less risk of accidental overdose. It's a smooth, gentle way for many people. For patients with more severe growth hormone deficiency, sermorelin may be the stronger option. And the third best resort for growth hormone deficiency is HGH. Now, if your liver is not producing IGF-1, then IGF-1 therapy is the last and final resort. It's critical to point out that more is definitely not always better when it comes to HGH therapy. The goal is to reach the Goldilocks zone of ideal hormone balance, thus maximizing the benefits and reducing the risks of treatment. This is also why it is so essential to work with a board-certified and licensed hormone specialist. The only way to get treated safely and legally for HGH deficiency is to undergo thorough analysis with a medical professional who knows what he or she is doing and has at least 15 years of experience and has thus seen all the ins and outs of these kinds of therapy over a considerable amount of time. While ipamorelin is very safe when used responsibly and with proper monitoring, there is a small risk of certain side effects such as heightened cortisol levels, headache, and nausea. Ipamorelin does have an impact on hunger response. In patients who are not committed to exercise, they can become hungry if they do the injections and exist in a sedentary lifestyle. An ipamorelin program requires regular exercise to get the fat blowtorched off the body. And, of course, eating healthy food is a necessity for the whole balance to work with synchronicity. Ipamorelin can have an accelerating effect. It can amplify fat loss/weight loss and muscle building, or it can make you fatter if you use it and do nothing. If you use ipamorelin and exercise regularly, you can even not be so overly concerned about diet, letting it slide a little bit, even though food is important, because of its ability to help with lipolysis, fat burning. But of course, nutrition is still a cornerstone of good health, and exercise is a significant pillar. If you can get the lifestyle part together of diet, by diet we don't necessarily mean eating less, but eating healthy foods which fire up the metabolism, like raw and steamed foods do, and low amounts of simple carbs, and exercise. How much should I expect to pay for ipamorelin? One of the factors which make ipamorelin such a desirable option for patients is that it is more affordable than traditional human growth hormone therapy. All things considered, a patient can expect to pay around half as much for a round of ipamorelin therapy as they would for the same duration of HGH injections. Human growth hormone is the most complex molecule produced by the human body, making it expensive to synthesize biologically. Sermorelin and ipamorelin have a similar price, much lower than HGH, so the ultimate decision between these two options will be dependent on the severity of your HGH deficiency and your goals with treatment. Interested in ipamorelin for hormone optimization? Contact our HRT clinic. If you found this video informative and would like to learn more about ipamorelin therapy or sermorelin acetate, HGH, testosterone therapy, please click the link below in the description of this video.